Welcome. My name is Conor Delaney. I chair the Digestive Disease and Surgery Institute at Cleveland Clinic, and I'm here this afternoon with Dr. Miguel Regueiro. And Miguel is our chair of Gastroenterology and Hepatology and Nutrition for our Ohio region. So he looks after a large number of gastroenterologists, a huge program across the region. But I thought I'd start by asking Miguel a little bit about his roles and responsibilities and some of the things that he might want to highlight about what he does. Miguel.
Great. Well, thanks for having me here today, Connor. And so my role, as you said, is I'm the department chair. We're up to almost 90 gastroenterologists now between hepatology, GI, and nutrition. And this doesn't just span the main campus, but really across the region. So we have a large catchment area. We work with a lot of physicians, health providers, and hospital systems as well to provide the best GI, hepatology, and nutrition care possible.
That's great. And knowing what you and the team are doing, it's pretty incredible what you're doing.
Thank you.
So what got you into this? What interested you in GI and then specifically in IBD? Because that's obviously your particular thing.
Yeah, no. So I think, that's a good question. When I was in medical school, I thought I was going to actually be a surgeon. Maybe not a colorectal surgeon, but I thought I was going to be a surgeon because I like the hands-on part of this. But then as I went through my training, I realized I liked the cognitive care aspect as well. So probably what originally drew me to GI is the fact that I could have hands-on endoscopic procedures, but also with a cognitive care base. And then IBD specific, it's interesting, treating Crohn's and ulcerative colitis patients, I was originally thinking advanced endoscopy, and part of my fellowship was directed toward that. But IBD came out of my passion for immunology and some of the research I had done in Boston in immunology. And then really the rest is history. Now it's taking care of wonderful patients and families over a chronic lifetime.
That's super. Typical gastroenterologist teasing a surgeon about the cognitive abilities of gastroenterologists. My sister's an endocrinologist, so I won't go there and I have to be polite at home.
You picked up on that.
Subtle as ever.
Yeah.
So look, within some of the amazing things you've done and all the work on postoperative IBD and Crohn's, you've come up with this concept of the IBD Medical Home and how we advance care for patients and centralize it around the patients. And maybe you'd like to tell us a little bit about that.
Yeah, so one part of my job is my interest in population-based health, and as you allude to with IBD, this medical home, but really for the department as a whole, I look at specialty care across the population as the future of medicine and these chronic care models. One of them is this IBD Medical Home, where it's not a brick and mortar building, but it's really a comprehensive wraparound 360-degree care model where patients with Crohn's and ulcerative colitis that come to us, we actually are able to prepare and take care of all of their needs. And in essence, we become their principal care provider. We focus on diet, psychosocial well-being. We link with the surgeons. All of you are really part of this medical home. And through this now at Cleveland Clinic, we're building a medical neighborhood, which actually we're linking through the electronic system to the primary care teams across the region, possibly now across the country, into this neighborhood feel. So I think these value-based care models, these chronic care models, IBD really lends to this as well.
It certainly does, and I think it's a critical need for us as hospitals and healthcare systems grow to having to look after populations. And when you think of the complexity of inflammatory bowel disease and the patients we look after, this is really game-changing. So congratulations and thank you.
Thank you.
So then kind of moving ahead a little bit, and maybe IBD medical homes are the thing, but what's the next big innovation coming along for patients in? Let's even think of patients with IBD, but what's changing and coming along that's going to change the field?
Yeah, no, I mean, I think that's an excellent question. Probably you're asked that every day. Patients coming in ask this. If I were to put it simply and not sound too cliche about this, I think it really has to do with precision medicine. And I think where we're headed in the future for all care models in medicine are, can we get the right treatment for the right patient without guessing on our medications or sometimes maybe even surgery? So the microbiome, the genetics, the immune system, can we target that more precisely and understand the patient coming through the door who may have a symptom complex, what's really their underlying problem, and really direct the treatment precisely at that. I'm happy to say at Cleveland Clinic, we're actually doing that right now with a lot of our biobanks, genetics, immunology. So I think precision medicine is the wave of the future.
Well, thanks, Miguel. That's been great.
Thank
It's
you.
a few topics covered fairly quickly, but hopefully that's of interest to the audience. And I really appreciate your time this afternoon.
Thank you.
Thanks again.
Thank you very much.
Look forward to seeing you with our next update in the near future.